No, it's always a good feeling when we can provide the community with much needed education. And in this instance, we are really fortunate. Dr. Zhu, Chang Zhu is our co-director and strategic management advisor for our MBDA. And I have Ethan Penha and yourself, John, with our special COVID-19 grant to actually host one of our own. And Reagan Branch is a consummate OSHA professional. And I can say that, given the fact that I myself am a union trained carpenter, certified welder, spent 10 years, over 10 years in the field, working in heavy construction, high rise. And I worked for some of the companies that had some of the most stringent safety protocol, the time, Kiewit Pacific, and so I really get it with site safety. And I think anyone who is a professional construction worker understands the importance of coming back with the same way that you left work. And everyone knows of those instances where someone is hurt on the job. COVID-19 presents a whole nother dimension of concern for those of us who really should be using protective equipment, PPE. Our our construction workers are the best trained. And however, COVID-19 presents a new dimension of dilemma. This is a silent and invisible killer. And so we just want to make sure that we give our community the best information and the latest information on how you can potentially contract this disease and prevent the spread. So with that, I'm so happy to introduce Reagan Branch. She's an OSHA professional. Please don't hesitate to recommend her. She's an MBDA member to your construction company supervisors. She can do trainings specifically for your company. And we're really fortunate to have her today in this last of the 3 series of workplace COVID safety, which has been generously underwritten by our MBDA COVID-19 grant. So with that, without further ado, I'd like to introduce Reagan Branch of Pyramid Solutions.
Hello, thank you so much, Roxanne. That was a great introduction. And thanks everyone for coming and joining. I love the construction community. I know that, we've been impacted like others by COVID, and we have, a higher level of potential risk, right? Because we're working in close quarters with each other. And I didn't want us to be neglected in this, process. So that's why, I'm really passionate about the presentation and the focus. And if you have any questions, please feel free to type them in. John is going to read them out to me so that I can, respond to them. So my background, as Roxanne said, I used to work for the Occupational Safety and Health Administration. So I did workplace safety and health inspections. And I, currently work within the construction industry as a site safety manager, but I'm also an industrial hygienist, a certified industrial hygienist. And I also am certified as a New York State infection control trainer. And so that's why in the process of this pandemic, I took on, learning a lot about COVID, the health impact, and, how it can impact, our community. So I'm saying that to say that I'm not a medical professional, but I do understand policy, and a lot of what we're going to be dealing with is the enforcement requirements from the Department of Buildings, OSHA, as well as New York State, and complying with that, because I know as small business owners and as enforcement professionals, people that are site safety managers, shout out to all of you that are on here, that site safety managers, we are really great with gathering information so that we can present it to the people that we're there to protect. And the more information you have, I think would be empowering. So without further ado, I'm going to continue with the presentation. So what I'm going to cover is a bit of the background, things that you probably can recite already, how we got started, what COVID is and so on. So there's also, like I said, enforcement requirements. So the communication plan is part of what New York State requires. They have interim guidance that they propose to the industry, as well as guidances for different industries. As Roxanne mentioned, we did a 3-part series. We talked to restaurant owners. We also talked to the theater industry. So there are specific industries where New York State created guidances for these industries to follow. And so that's basically what I'm going to delve into, letting you know how to comply with this enforcement requirements. So like I said, communication plan is part of that. The other thing is a mandatory safety plan, right? So as part of the communication plan, you have to have something physical written, and they actually created a template for you, which I'm going to send out, or John is going to send out to all the participants so that you don't have to do this from scratch. The state actually created something that you need to read, acknowledge, sign, and keep on site, right? Because if you don't keep that, the likelihood is that if you get an inspection, and if you're in New York City particularly, Department of Buildings may enforce it and give you a fine for not complying. As well as agency enforcement and liability. So which agencies? New York State, Department of Health, OSHA, Department of Buildings for New York City, and I'm sure authorities outside of New York City, such as Westchester, they may have building departments that enforce construction-related requirements that are set by the state. All right. And then also liability in terms of like tort, right? Because you can potentially be sued by your employees for exposure. And that's a possibility that I'm going to show because there is precedence for that in terms of businesses that have been sued because of health-related diseases being spread within their environment. So we're also going to talk about solutions and strategies, as well as provide you with some reference sources because, you know, this is a great talk to attend, but you want to also be able to take things back and implement them in your workplace. And part of any safety policy or discussion is always implementing and ensure that it works, okay? And then also industry, organization, and standards. As I break down the mandatory safety plans, there is requirements for testing and screening. There are physical distancing and occupancy requirement, controlling of hazards, hierarchy of controls is going to be discussed. Site and employer logs, that's a requirement as well by the state. Hygiene, cleaning and disinfecting, protocols, procedures for dealing with positive workers are also going to be discussed. So this is going to be an interactive. We're going to have a little poll. It's also going to have some video to, you know, just give you various forms of information. So recently there was a study published that basically stated that construction workers were 5 times more likely to be hospitalized due to coronavirus, especially on job sites where it's unrestricted, meaning they haven't implemented a lot of these requirements that New York City had, New York City Department of Buildings or New York State has required of construction workers, mainly distancing, personal protective equipment, and so on. And this speaks to the fact that within these communities, essential workers tend to be of lower income, probably live in multi-generational households and don't have the ability to not come into work, right? So they need a paycheck, they may come in, they may risk or may unknowingly come into work and expose themselves or others to become exposed or expose others within their workspace. So like I said, construction workers are 5 times as likely in a population where they're working unrestricted to be exposed or hospitalized due to COVID-19. And this is just a video that I'm just going to talks about a particular site.
A Chinborough construction site in Augusta has been shut down after an outbreak of COVID-19. The director of the Maine CDC says 19 workers at the Maine Veterans Home construction site have tested positive. Some are from Maine, others from out of state. It's unknown how long that site will be shut down. For at least several days, up to 14 days, while they increase cleaning as well as increase monitoring of individual construction workers who are at that site going forward. Shaw says they're investigating how the virus was spread at the site. TV5 has reached out to Chinborough officials several times, but no comment so far.
Well, we potentially know how things like this happen, right? Go ahead. First full question.
I'll give 45 seconds. We ask that all participants please answer the poll. Still waiting on a few. Fifteen seconds. Three, two, one, and polling. Here are the
Okay,
results.
So yes, the majority is correct. This is actually true. This was the only published statistics that I had from the Department of Buildings. But right after we entered phase one and we allowed, New York City allowed the restart of construction activities, based on about 6,100 complaints from the public, as well as, just the use of the GIS system to map out where construction activities have been started or registered. The health inspectors, not the health inspectors, but the Department of Building inspectors actually went out and issued 88 violations and 41 stop work orders related to COVID between the beginning of the shutdown and July. So I don't know what it's been since then, because we haven't had anything published, but this is really significant. And this is to show that not only from a perspective of, yes, you want to protect your workers, but also this is going to stop your work if you don't comply, right? This is going to hit the pocket if you don't comply. So for contractors that don't want to comply, that are about getting the work done, this is why you need to comply, because they will shut you down. Right? All right, so a bit of the background. So I've used the Johns Hopkins case progression website since the beginning when I was doing this training. So in early March, I believe the first time I went was like March 8th was the first presentation I did to a group. And this on the left was March 17th, right? At the time, the tracker was tracking about 182,000 people worldwide that had this disease. About 7,000 deaths were recorded from them. This is the time where we had, we were seeing scenes from Italy and other parts of the world, right? And, barely becoming an issue for New York City. As of last month, when I was doing this for, I believe around the time we were doing the restaurant, I checked again. It jumped up to 40 million. Worldwide, and we had over 1 million deaths within that time period, within a 7-month time period. So that is to show you, we know, but numbers don't lie. This is to show you how rampant, how much of a spread there's been, in a very short period of time. So October was good, but I was like, what's actually going on now? So last night I checked, and we're up to 63 million. Just in a month or 6 weeks, and over 300,000 additional people have died within the course of that time frame, right? So, we talked about the enforcement part of it, but there's the real, bones behind it is that we want to make sure that people, communities actually don't die, get sick, are threatened long-term from this virus, right? It's serious. It's having an impact not only socially, but community-wise and also for industries. All right, so just bringing this a little bit closer to home in terms of the background. So for the United States, we learned about this disease coming to our shores around early December. So early January of this year. So January 17th was the first US cases. New York City recorded their first case on March 1st. By March 7, we had declared a state of emergency because there were 47 people that were found to be positive for this virus. 3 days later, on March 10th, the New Rochelle cluster and containment zone had been discovered, right? So around if I don't know if you recall, within New Rochelle, they had 108 people of the state's 173 people living in that particular community because of someone going to a wedding or whatever the case is. So as a result of that, on the 16th, the governor instituted an executive order that closed all schools or restaurants, limited it to takeout. And then a couple of days later, 4 days later, we went statewide on New York pause, right? So schools were shut down and all of that good stuff. So by the end, there's this particular site that I went to. They recorded up to the beginning of April. So by that time, by April 13th, we had 195,000 cases of people with coronavirus in New York State, and 10,000 people died. That is in 6 weeks, okay? So March 1st to April 13th, that was the growth. And now that we're in this new phase, going into the winter, you know, that's why there's this push to ensure that we've learned our lesson, and we want to make sure that we're able to function and people can work and earn money, but also do it really carefully and follow the rules and the lessons that we've learned. All right, so the first executive order we had was Executive Order 202. It declared a state of emergency in response to the COVID virus. And then Executive Order 206 required the elimination of 100% of the in-person workforce for non-essential businesses in New York State. And then it was revised a few days later to give guidance, particularly about what is considered essential work. And as you remember, they reduced construction workers as from being considered essential. So unless you were working on a bridge project, you know, some kind of a municipal project, you're working on a hospital or you know, affordable housing project or something like that. What happened here? They didn't consider this to be essential, right? So the only regular construction sites that they allowed to work were those where they needed to take care of safety related conditions, so that, you know, there are no wind, you secure your site basically for whatever the duration was going to be for this shutdown. And then again, just in terms of the mandates, we went into phase one, where construction was considered one of those industries that were allowed to open, and there was a reopening June 8th. And then the state issued guidance, this particular guidance that we're talking about, on June 26th, of how to comply and ensure that workers are not exposed during you know, the normal construction activity. What is that? Sorry, I don't know what happened with this line here. All right, so we're going to talk about the communication plan now. Are there any questions relating to the background information? Okay. Again, if you have any questions.
The question that was asked was regarding the collateral that will be sent afterwards.
Okay.
And I've taken care of that in the chat group. I'll keep you posted.
All right, thank you. All right, so communication plan. All right, so first of all, in the sphere of safety and health, of industrial hygiene, we want to anticipate and recognize COVID hazards, right? So that's one of the frameworks the Department of Labor, OSHA, gave us on how to deal with this, because they had nothing like this before. I mean, they had, like, you know, West Nile and those types of diseases, but it wasn't something that had the kind of spread that this disease had. And so they created a guidance, and one of the things is, like, anticipate and recognize some of the hazards, right? So you can figure out what kind of industry you are in and what protections you need to take, right? So with regards to New York State and New York City, The mandates that they have is that this guidance that was created, they required all employers to read and affirm the guidance, right? So you have this plan, which you're going to get a copy of. You want to make sure that you read it. There's a part for you to sign, and put your company information in the parts that are provided. But then also they want you to send them an affirmation. So the physical part copy you keep for yourself, and then there's a separate document that's called an affirmation that you would send to the state, which it is done electronically, which would certify that you've taken the time to read and understand what protections you need to put in place for your workplace, right? So as part of the communication plan, you also need to establish training of all your personnel. You also need to have signage. There's a requirement that they have a designated COVID person. And so the site contact information for that individual would be important for you to communicate to staff. As well as updates and alerts. So how are you going to send out emails, texts? What are the telephone numbers that are important for these people? Like, so for instance, if you find out, like from you're doing testing, independently, I got COVID, I was working 2 days ago. So who is it that you're going to contact to let them know that this is something that, as you're required to do, notify that you have been exposed. So who are the people? How are you going to communicate that? All of those things would need to be created by the employer as part of your communication plan. All right, so some of the things that you were going to cover in training. For instance, we know how COVID is spread, right? So from person to person. So construction site, of course, as in the picture on the right, we're working in close quarters. We're like, we're interactive, we're touching, we're tactile people. We communicate closely because there's noise around. We look at the same plans and prints and that kind of thing. We're touching surfaces. So person to person contact is definitely there, right? Primarily from respiratory droplets produced when infected person coughs or sneezes. So, I've been on sites where there's no one takes out a piece of Kleenex and wipes their nose. They go, they do that nostril thing, right? So respiratory droplets, also just talking to people. Prior to now, there weren't a lot of hand washing sinks available, right? There's also airborne transmission from person to person. So if you're working in a shanty or you're working very close office space, a couple of people are squeezed in together, you're talking, it's going to spread, right? So these are considerations, and that's why for construction, it's an issue. Touching surfaces or objects contaminated with the virus, then touching your nose, your mouth, your eyes. We have porta-johns, right? We have barely doors on our bathrooms. Historically, have we taken time to wipe down those surfaces? No, right? And then also, like if you're in a close quarter and you're talking, this is what the small droplet issue is about. Like if you're vigorously working, you're sweating, you're respiring at a higher rate, you're putting more droplets into the air. So if you leave that space, an enclosed space, someone comes in after you, there's potentially that leftover there that you can be exposed to. All right. So the orientation of personnel, part of your communication plan. So this is actually on the right, the OSHA pyramid, where they created it so that workers or employers can assess what level of risk to COVID their work staff may have. So based on the levels that they describe, I would say that construction is between a medium to high risk category, right? So the medium category are jobs that require frequent close contact with people who may be infected, but who are not known or suspected patients, right? The high-risk category are jobs with high potential for exposure to known or suspected sources of viruses. So we're going to explore, why medium, why high. And then, like within our industry, you're going to see in another video, there are a lot of people that are asymptomatic. And so, the medium or the high really, they could be low risk. And if you're asymptomatic, you can still expose your coworkers. All right. So hazardous activities that put construction workers at risk. Who are at risk, especially, right? So if you are working within 6 feet of someone else, you're at risk. So that's practically most construction trade personnel. If you're handling and cleaning of waste, so you have the laborers that are cleaning up after individuals, right? If you're touching surfaces, you're going through many doors, you're lifting, you're pushing, carrying things, handling tools, you're touching surfaces. If you're working without masks, so the plan talks about, well, if you're the only person working in a specific area, you're free to work without a mask. However, if you cannot distance yourself, then you need to have a mask and reduce the occupancy level. Okay, if you're doing work that requires you to have heavy breathing from strenuous activities, certainly in construction, certain trades, that is a factor. So the individuals or the trades personnel that are at risk are certainly right now, as we went into this phase, the people that are doing screening and security, because they come in contact with nearly everyone that comes to the job site to some degree, right? Workers that are doing drywall, because you cannot lift and put in place a piece of drywall on your own. You do that in teams. Glazers. So all of these operations where you have multiple people carrying a piece of equipment, piece of material, doing activity as a group or a pair, there is a potential for you to be at risk. Hoist operators come, and I would say a hoist operator would be a high risk because they're coming in contact with people at a higher level, throughout the day as they go up, open doors, and multiple people going to their lift. Certainly site safety manager, as well as the orientation team. They're the first people that you see, when you have a new group of people coming on site, right? So you have these big rooms and you're sitting at a table, you're sharing pens, you're writing next to each other, and there's a potential for you to be exposed in that sense. The administrative team, I would say they would be low to medium risk because, usually, the GCs, people are in big spacious rooms, at least when you're in the middle of the activity where there's a good workspace. But I think initially, there's that potential where you're sharing a small space and you can potentially be exposed. However, the good thing with these individuals is that they can work remotely to some degree, unless you need to be on site. And so that gives you a little bit of an opportunity to be distant. All right, so how does exposure occur? So these are some instances of actual sites that I've been working on and observing, and people are working in close quarters. So this guy's doing drywall. He's going to pick up that piece of drywall, hand it to his fellow worker on the stilts, and actually had to push them to put on their mask because they were not wearing their mask at that time, right? These guys on top here, they're doing some rebar work. They're tying rebar, and they are outdoors, yes, but still quite in close proximity. We had the same issue where one person was not complying and the other one was really, on the ball about it, but still had to be pushed, right? Again, we have workers that are on the street. They're standing right next to each other. No one was wearing a mask. And certainly there has been a lot of activity with construction of building out these temporary restaurant structures on the street. And, I've seen, people working in close quarters with each other. So we're very, team-oriented, hands-on, very close industry. And this is why there is such a big risk to that would cause, the original statistic of, construction workers being 5 times more likely to be hospitalized. Of course, there's the social aspect to it, but certainly the type of work that we do requires to be very close, within 6 feet of each other. All right, so here we go.
Health officials are saying they are seeing more construction workers who are getting coronavirus, and that is causing a lot of changes for their workers.
Yes, our Anthony Castora found out the biggest challenge construction sites are facing when it comes to the virus spreading.
J.E. Dunn started screening its employees for COVID-19 more than a month ago, using short surveys and temperature checks. At its largest construction site of about 600 workers in South Charlotte, they screen workers every day for a total of more than 23,000 screenings. If someone shows symptoms, they're tested, along with anyone they came in contact with. 40 workers have tested positive so far.
Even with the screenings in place, including the questionnaire employees fill out before they clock on, the biggest challenge here is that the majority of people who test positive are asymptomatic. It was a big surprise to us, the number of non-symptomatic positive cases we had.
Through contact tracing, Rich Soretti says the company identified 75% of people who didn't show signs of sickness. That means they could have passed the screening and continued to work. Just this week, the county health director said they're seeing an alarming spike of confirmed cases involving construction workers.
The contact tracing has been a huge, I can't give enough credit to Mecklenburg County Public Health and our hospital systems. The testing has been fantastic.
The county says it wants to work with construction companies like Soretti's to target messages for employees. The CDC is also recommending construction workers wear face coverings on the job and don't share equipment. That's something J.E. Dunn is already doing, and Soretti is prepared for even more guidance as this situation constantly evolves.
I think that the order of the day has been adapting to what we're hearing from the CDC and from local officials, and what else comes next, I can't see right now.
In South Charlotte, Anthony Castora, Eyewitness News.
All right. So any questions so far about, that particular issue or that section that we talked about, the communication plan? Okay, so we're gonna do the second poll. John? Oh.
Well, once again, we'll give about 45 seconds. We ask that everybody please participate in the poll. Another 10 seconds. 5, 4, 3, 2, 1. Is the end of the poll. Here are the results.
Okay, so yes, so if you selected depression and anxiety, it's not a symptom of COVID, right? All of the others are, sore throat, loss of taste and smell, headaches, fatigue, shortness of breath, coughing, fever, and chills. So depression and anxiety may result from the whole quarantine and secondarily, but it's not a symptom of the actual disease. So this is just kind of like giving you a hint that we're going into more about the disease as well. So someone said that in the chat that they were having a hard time hearing. Is that still the case? I turned up the volume.
Yes, unfortunately. It should be better when we have it on the YouTube link, though.
Okay. All right. So we talked about what the symptoms are, just a little more of a visual because, hearing it and seeing it, helps. Right. So definitely cough. We've seen these flyers. CDC has been doing a great job of putting these visuals out there. You've used it for my residential building. We've used it in the actual work settings. So yeah, they're very good.
Reagan, before we move on,
Mhm.
we do have one question regarding the symptoms.
Go ahead.
In response to the last video, if someone has none of the symptoms, how can we really minimize the spread?
So yeah, we talked about the fact that these are asymptomatic people. So, outside of those individuals, there's no mandate that people be tested by the state, but ensuring that you have the proper protective equipment, which we're going to get into. And then also within the guidance, they gave you requirements on how to properly distance. If you can't distance yourself, PPE that you can be using, administrative controls, engineering controls, which we're going to get into a little bit shortly.
That was a really good question. Any question that you guys put into the group chat, we will answer. We'll try to answer them as promptly as possible. If there's a good break in between, I will interrupt Reagan, but I will try not to interrupt her. And if we don't answer them, we'll answer them before the next poll. Thank you very much.
No problem. All right, so we're gonna do, just to push it home again, a little bit more about the symptoms. Okay, so this really speaks to that question of, yes, these are the ways to look out for the symptoms, but people may not have that. As we saw in that video, 75% of those that were tested were asymptomatic. So it really speaks to the requirement that you as the employer, as the safety individuals, the designated safety person, take steps to enforce distancing as much as possible. I've been to sites where people are sitting and they're eating lunch like it was, nothing, and they're having conversations. No, you got to distance yourself. In earlier phases, like I've been to construction site and had meetings, and I was like, everyone spread out, and people are sitting right next to each other on a piece of sheetrock or, a piece of cinder block. No, you cannot do that, right? So really enforcing that, even though it seems maybe that you're treating people like they're a child, it's really essential that you drive it home and that they understand and they take responsibility as well in understanding that. Okay. So I'm just going to come off video for a second. I didn't want to put a lot of notes out there, but so I want to refer to my notes, and I don't want you guys to think I'm not paying attention to you, but just getting a little bit more into the actual interim guidance that the state mandated. All right. So after establishing a written program, inform workers of the protocols. New York State Site Safety Plan format includes people, places, processes, employer plan, and then as well training and retraining of workers when protocols change or are updated. And this is how the plan looks. And again, you're going to get that as part of your handout. So in terms of the people, so that includes physical distancing, gathering in enclosed spaces, workplace activities, and then movement and commerce. So under people, of course, it says that no more than one worker per 250 square feet is allowed on site, right? So that's not always possible. So this is without any protection, right? So if you cannot allow for 250 square feet of distance between individuals, then you have to have additional protective measures implemented. So at any time, employees must have 6 feet away from another or have acceptable face covering worn to prevent any type of spread from communication. It talks about what kind of face covering is acceptable, right? So disposable cloth, the N95s, those are all acceptable means, right? You cannot have people share masks, and you have to have adequate supply. So if there are a number of workers at a station, you want to ensure that you modify or restrict the workers to at least 6 feet. So that goes for lunch areas, right? If you have a bench system, you want to ensure that people are not in 6 feet of distance from each other, either from the front side, their side, or their back, right? So you have to have sufficient space. And that when they are, in meetings or in areas where you have close quarters, you want to have sufficient distance. And then, of course, face covering when you're there. Also, have meetings in outdoor areas where there is better ventilation, on floors outside of shanties, that type of thing. I've seen, morning meetings and toolbox talks being done on floors where it's not enclosed, right? Or outside, if the weather permits. So put measures in place for bi-directional foot traffic. So I've seen in certain locations where, we have one staircase dedicated to go down and one staircase dedicated to up. That way you can maintain the distancing as people are just behind each other or above each other as you're going up or down. There's also a mandate that you have signs throughout the site that talk about this distancing, and also the requirement to wear protective equipment. So cover your nose signage, properly store and use or discard, how to properly store, use or discard PPE, how to adhere to physical distancing instructions, where and how to report symptoms of COVID, making sure that you remind them to follow hand hygiene, cleaning, and disinfecting guidelines, as well as proper hygiene techniques, how to properly, cough and sneeze and, dispose of your used Kleenex in a waste trash instead of on the floor, or, put it in your pocket or something like that. So with regards to the gathering in enclosed spaces, they want to make sure that instead of doing the in-person, especially for those administrative individuals, maybe you do a teleconference, right? If all of the superintendents don't need to be there, have a teleconference or stagger who comes in, on certain days of the week. Make sure you have meetings in open areas again. Make sure the spaces are well ventilated. You can, if you have to meet in an office, you can have air purifiers in there. I've seen that done. Keep the doors open. And make sure, of course, adequate distancing in locations such as hoists, restrooms, break rooms, and posting the capacity for those rooms so that workers know that, we've meet capacity if we have 4 people in here, so they're not squeezing in there. Stagger lunch so that, not everyone's going to lunch at the same time. So things like that. Also, with regard to workspace activities, the state suggests reducing interpersonal contact and congregation. So limiting in-person presence to only those staff that are necessary to be on site. They suggest also adjusting work hours, which may not be feasible in certain circumstances, but certainly can be done. Reducing on-site workforce to accommodate social distancing guidelines. If you're doing window work on, one floor and you have a team of people doing marking or sheetrocking, stagger that so that you have appropriate separation of individuals, so that you can avoid multiple crews being in the same space. So with regards to movement and commerce, the state under the people section says non-essential visitors should not be permitted on site. So people coming to the site to have job interviews should not be there. Coming to drop off stuff for family members or coming to visit your colleague or whatever, that should not be, right? You want to have designated areas for pickup and deliveries established so you can limit contact to only people that are necessary. And also want to limit on-site interaction, movement, so that you have people, not going everywhere, because that's how the spreading occurs. And that's how when you have situations where work workers are working in a specific area, they can say, well, I was only in here such and such, and these are the people that are potentially exposed, while I was positive. In terms of places, protective equipment, we know the basics there. Make sure there's an adequate supply of masks. Make sure that people are aware of how to clean it if it's a reusable type, or how to replace it if it's not reusable. And certainly you want to ensure that you're complying with the requirements for regular construction safety. So if you're doing work that's already requires you to wear an N95, you don't want to forego that to have people wear a surgical mask, right? Because the surgical mask is not going to protect you from silica particles, right? Or just as if you're a laborer and you're cleaning and you're just preventing yourself from being exposed to dust particles. So making sure that you're complying with the existing construction safety requirements. And so limit also the sharing of objects, such as tools, machinery, materials, vehicles. If you can't do that, make sure that you have appropriate supplies of cleaning products, wipes or whatever, so that workers can wipe it. One of the solutions that they've reached on one of my sites is that workers must wear disposable gloves throughout the day underneath their work gloves, right? So that limits the amount of potential for spread from their hands. Of course, that would require them also to wear a mask and they're not touching their face and so on, so that there's no contamination on their hands. With regards to the hygiene, cleaning, and disinfecting underneath the place, part 2, of course, you want to make sure there's adequate supply. There's cleaning stations available. So I'll show some of what's been done already, making sure you provide hand washing sinks, alcohol-based hand sanitizer dispensaries, and so on. Proper signage, proper receptacles, proper cleaning and disinfecting supplies. I said that before. And then also a schedule of cleaning. How are you going to clean as, for your particular crew? Because guys are going to come and eat, and girls and ladies are going to come and eat lunch in their particular area. You want to ensure that 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 desk or bench or whatever is clean between people, right? Just like they do in restaurants. And making sure that the supplies that you have meet the EPA mandates and are able to kill the virus. Within the communication plan, making sure that you sign and have the the paperwork. You have this plan on place. You have the affirmation, and you have logs. And we'll get into some of the logs that are required for people that visit the site. Keeping count of who's visited because of that contact tracing portion. Like you need to go back and tell those people if someone was exposed and was positive, and if they potentially could have been exposed. And so in terms of the process, part 3, screening and testing is something that the state requires, making sure that, this daily screening survey that individuals do, and then testing for temperature, even though in cases where people are asymptomatic, it's really not going to help, right? Also, one of the important things is because of the EEO requirements, you're not supposed to actually keep the actual temperature, the actual number. So if a person was 99 degrees Fahrenheit result, or even if they were 96 degrees, you're not to actually write down the number. You should be writing pass or fail, because you're not supposed to be keeping that specific information due to HIPAA and EEO laws. I'm not sure if you're aware of that. All right. So a central point of contact, which you have designated for responsible, that person, that location is responsible for receiving and attesting to having viewed questionnaires. And that individual would be the person you'd likely contact if you tested positive. And the site safety manager also, being involved in that process, or maybe the one, partaking in that role. Also managing the logs of every person that comes to the site, including visitors. It excludes the requirement for deliveries that are performed with the appropriate PPE through contactless means. And then also tracing and tracking, which is important. That would be part of the Section 3 process, making sure that you have the logs in place to do this when necessary. But also the requirement to cooperate with the state and local health departments so that they can do their proper tracking. And visitors who entered the site dating back 48 hours before the work began that experience symptoms, you have to communicate that to the state. All right. And then also maybe come up with a system where there are alerts via tracking, tracing, and other mechanisms where workers can self-report if they're positive and, alert, either their GC, the safety manager, or their supervisor about what's going on with them health-wise. And then finally, part 4, which is that plan. But like I said, you'll have a copy of this and you can go through it in more detail. I also included this reopening checklist, which has mandatory as well as recommended best practices for sites. And this is on the right, what the affirmation looks like. And this is the one that you submit directly to the state. All right. Any questions there?
Yes, we actually have a few.
Go ahead.
So let me move up to get to the first one.
Mm-hmm.
All right. Are the COVID-19 safety awareness materials provided by the state in multiple languages?
I'm not sure about that. I'm sorry. I didn't check whether that was the case, but I have the link in the back of the presentation, so you can check and see.
And I also checked with the CDC, has a guidance for construction, and it is in multiple languages on the website, a link that I provided. So you can select, there's a drop-down menu to select at least the CDC guidance on construction COVID safety in multiple languages. So I would suggest printing those and posting those where you put your other material safety data sheets and et cetera for the site.
Yeah, but in terms of compliant, I'm not sure if they have it in other language, the particular guidance. I will check and let you know post presentation. Next question.
Next question comes from Pauline from JPR Builders 7 Inc.
Mm-hmm.
She says, N95 is now scarce, but OSHA recommends it for certain scopes of work.
Mm-hmm.
How is this being addressed? Are there waivers or no fines to employers once they provide masks?
Okay, so N95 is not a requirement specifically for COVID. You remember I said, if you are doing work that's related to respiratory exposure that is protective with N95, you still have to comply with that requirement and have your workers wear the N95. If you can't find N95s for that particular work, they had waivers. They had a waiver at the beginning for healthcare industry. But that is not something I believe they still enforce, right? Because they're finding healthcare industries right now. In terms of if you're saying, we can find N95s to do our construction related work, you have to figure out how to protect your workers. So you can use engineering controls, you can use administrative controls instead if you can't find an N95 mask. So eliminate the airborne hazard, but you can't just give them a cloth mask because then you open up yourself to a fine. Because it specifically says that, both within the state plan as well as OSHA, they're not gonna have a second thought about that. And PPE is always the last level of protection with regard to safety and health hazards.
These questions are really good. Please keep them coming. The next question is regarding the documentation of pass or fail. It says, How does this affect HIPAA when pass or fail still says who failed?
Well, that's going to be known but from the contact tracer anyway, right? That's something that still has to be made known to the state. So, just, from the perspective of, what number it was, it doesn't make a whole heap of sense, but basically that's what it says. You can't keep the actual number. You have to just put a pass or fail or something to that effect.
And the
But
last
yes,
question.
I do recognize that they would still know who is positive or not, but just also with regard to OSHA, what they allow is if this is a recordable case, you can prove that it occurred on site instead of in community, then you still have to put it on your 300 log, but you cannot, if the employee don't want you to, you can withhold their name and just maybe put a code or something. But yeah, there will still be some knowledge of who the person is, especially since the requirement for contact tracing. Go ahead.
The final question that we have is, what if we have multiple job sites?
Mm-hmm.
Does the form specify a specific site?
It has to be site specific because you have to put the address of the site on there. Right? Because every site is different. So one of the things that they have you go through is evaluate, do you have the ability to socially distance? Do you have the right amount of sinks or cleaning facilities available? Things like that. So it's specific to the site because every site, one site may be in the foundation phase where you're, sitting in your car and you have a tiny little shanty, or it could be like you're in the, you're about to top off and you have a full office and people can, distance and you have shanties and that kind of thing, right? So it has to be specific to the site. You have to assess the hazards at that particular site. All right.
Thank you. Thank you very much, Reagan.
No worries. All right. So in terms of the communication plan, some of the signage that I've experienced and saw are things like, or as required, capacity notice, directional signage and distance markings, hygiene reminders, wash your hand sanitizer, and then Department of Health, compliance requirements posted. And then employee reminders. So some of the things that I have are, I've seen the hand sanitizer, of course, this is Department of Health requirements, wash your hand, how to clean your hands and things like that. Capacity postings on hoist areas, site-specific job site COVID prevention measures, English and Spanish, as well as directional signs for staircases so that, you're limiting traffic in one direction. All right. So that brings us to poll question 3.
Once again, we ask that everybody participates. We'll give about 45 seconds. More than half have answered. We have about 15 seconds. Five, 4, 3, 2, 1. Ending the polling.
Yes, so that is false. So every contractor needs to have the safety plan, right? Because you may have people that are not going, or trades that are not going to be located on site. They're not going to be staying on site. They come and they do, work for a week and then they go, but they need to have a plan in place, right? They need to have a plan in place. That's it. And that's the state's mandate. All right, so we're going into now the mandatory safety plan, written plan. So like I said, you can create something of your own, this contractor did, or you can use what the state gave, right? And that's acceptable. Again, it's a part of that package. You'll be able to put your name, there's a specific section like under the people part of it, like, are you able to social distance? You're going to write, yes, I'm able to social distance because I have this many trailers, or people are not going to be eating on site, whatever the case is, right? So there isn't a template, like I said, and that's going to be provided to you. And if you choose to be, you can be more strict than what the plan mandates. So in addition to the state's mandates, you have Department of Buildings, which follows the state's requirements, right? So, but basically what Department of Building is doing within New York City, and I'm not excluding you that are outside of the city, but maybe a local agency within your jurisdiction is going to enforce the state's mandates, but Department of Building is who are enforcing within New York City, right? So the city, as we saw in the beginning, they came out, they gave violations, they gave stop work orders. They're checking to see that you have this plan in place, right? So it specifies where you need to have the plan posted. So safety plans and affirmations should be posted at all points of egress from the construction site. So DOB inspector wants to be able to see that as they come inside, right? So beginning in July 8th, failure to have security plans and or affirmations posted conspicuously and available for inspection, meaning you actually have it, will result in a violation to the permit holders carrying a fine of $5,000 or the issuance of a stop work order, right? So this is very important. All right, so mandatory screening. A lot of places have put this into being where they have, either a queue in the mornings where workers, answer questions beforehand, or they, the individual that's doing the testing asks them if they have had those symptoms, the screening questions, they've kind of come in contact with someone that's had the symptoms, they've traveled, and then their temperature is checked. All right, so that's something that's required, the mandatory screening. So you can have an individual do it. I've been to places where they have back camera, which does the body temperature thing, and you go in, right? Sites where they have the badging system would be able to keep track of who's on site. Unfortunately, those that don't, you're not able to do that. That's something though that is required, right? And certainly if any individual has the symptoms or they've tested, their temperature at 100 degrees or higher, they should not be allowed to go on site at that point. So that's an instance where someone's queued up, and this is the actual line that you'd see at that location in the morning, where individuals are encouraged to be socially distant and so on. All right. So the physical gathering portion, these are examples of contractor meetings, safety meetings, orientations that are done outdoors or open space or in open spaces outside of the shanties where they typically would be done. Of course, we're coming into the winter, so we're gonna have to figure things out, but maybe you can do your orientations at least, remotely prior to coming to the site, maybe the day before or something, right? So that you work out that you don't have to be in a room, so that when you get there, you just present your credentials and maybe do whatever else you do. Some places do, drug screenings or whatever, but so that you can expedite the on-site and onboarding process. So of course, we know construction can be done remotely. But you definitely need to ensure that if you can't maintain 6 feet distance, you have to wear a face covering. But most sites that I go to, they have someone that's walking around a monitor that says you wear your mask regardless, because you could be in one location in 1 minute and then move, and then you're within distance of someone else. So make sure you have your mask on all the time. Enforce that with your workers, enforce that with your, if you're site safety, with your crew, or, the people that you're in charge of. So modify workstations and their use to limit any kind of interaction. So physical barriers, if it's a small office space, put a plexiglass just like they do in restaurants, right? Increase ventilation, reduce bi-directional foot traffic, in-person work gatherings, make sure that that's outside, do teleconferences. And you can also stagger and social distance when you're having workers come in or whatever the case is, or work. As a part of the mandatory safety plan requirements, you have to have occupancy requirements posted. So you have to limit to 50% capacity in small spaces, regardless of PPE use. So if you're in a hoist, in this particular hoist, the capacity may be 30, so they limit it to 15 individuals. Ventilation with outdoor air should be increased to the greatest extent possible. So if you can let air into your office space, I know that's difficult. Usually they're in basements or, windowless, but maybe keep the doors open, right? Have a air cleaner in there, a HEPA filter, device, portable device or small device. Make sure that if you have restrooms, unless they're individual stalls, let workers know what's the limit, the capacity for them to enter into that space. And also understanding the hierarchy of controls, and this speaks to the N95 mask situation. PPE is the last level of defense, right? You don't want to leave protection to the worker. I'm not in terms of general construction safety, right? But that also applies to COVID, right? You can have engineering controls, physical barriers, plexiglass dividers. You can install HVAC systems, maybe in a situation where you have an existing building, you're doing renovation. You certainly can't alter the HVAC system, so at least you have the MERV filter within that existing system, right? You can have administrative controls, and those are things that you're changing the way of operation, right? So it's not physical change, it's not using a particular equipment, but in things like implementing a screening policy, restricting access only to certain parts of the workplace. You're working on floor 2, you don't be in any other location but 2, right? In the west area or the east area. Consider strategies to minimize contact. So, use of, the aided arms. If you're doing sheetrocking, there are equipment that you can purchase that would allow one person to install sheetrock, because there is that, I forgot what it's called, that device that you can have basically position the sheetrock, right? Or if you're using maybe you're installing sheetrock at a higher height, instead of being in a scissor lift where you're on the same lift, maybe you're in 2 separate lifts. If you have the smaller personal ones, that would allow you to be more distant. Or you have to be in that one lift, you have to be in that small space. In addition to a mask, maybe have a face shield, right? The COVID face shield, not the construction face shield. So you have that secondary level of protection available to you. And that speaks to PPE, right? And so a combination of all of these would be good, especially because PPE is what they are, in this particular situation, is what is the most protective. Additionally, to the mandatory safety requirements, they ensure that they're required that you ensure that you have PPE and hygiene stations. You want to have the adequate supply of these masks available, of face shields, of disposable gloves, especially for your laborers. You have to train workers about how to properly clean, dispose, reuse, how to store their masks, because I've seen masks just thrown on the, outside of, a hook, right? Proper storage is important. Proper disposal is important. You don't want a laborer having to go pick up, a mask that's been used and, touching the vapors that's been, excreted by you throughout your workday, right? How, with the number of available supplies possibly going down, how frequently can you reuse a mask, right? And that's something you want to look to the manufacturer on, and also just assess cleanliness. Like, if at the end of the day it's black, you certainly don't want to reuse that, right? And then also training on how to properly don and doff PPE and what is proper fit, right? So for people that are new to safety, donning and doffing mean how to put off and properly take off. So for instance, with a pair of gloves, you don't want to be touching your hand, the uncovered part of your hand with the glove in the process of removing it, right? You're grabbing it from the inside, you're grabbing it from the fingers, you're pulling off one side, and then you're putting your clean finger ungloved into the gap between the glove and your hand, and you're rolling it off, put it in a bundle where the outside is not exposed, and you're putting directly into a garbage can, right? Fit is important when it has to do with respiratory protection, in terms of if you're wearing an N95 or if you even wearing a surgical mask. You want to ensure that there's no gap between, or as little as possible gap between the mask and the face, okay? So, squeezing those metal parts around your nose, I know it becomes an issue, especially with the fog and the safety glasses, but, I've seen people devise ways of using them that allow you to have both. Any questions? All right, so that brings us to poll question number 4.
Once again, everybody, we ask that you all participate, and we will give about 45 seconds to answer all the questions. Thank you. Five more seconds. Poll is ending now. Here are the results.
Yes, so the first one, safety plans and associated logs are to be maintained and available for inspection until the requirement is rescinded, okay? If an employee leaves a company, you would still need to have that material because they can file a lawsuit later on, right? Or the OSHA may want to see that, right? So OSHA, for a lot of these standards that require you to keep records, would do a minimum of 3 years or longer, depending on what kind of exposures they are. So you want to make sure that you're keeping it until it's rescinded. And that's per the state. So what kind of logs do you need? So contact tracing, customer contact sheets. So if you have people that are coming on site and they're on site for a long period of time, you have some kind of a log indicating that they're on site. So most places take care of that because they have IDs where you badge in and badge out, or you go through security and you have a sign-in sheet or something like that. But there are a lot of places that I've been to that no one tells me stop or anything. So that's important for you to have as, say, a GC for a project, right? Or if you have someone, if you are a supplier or something like that, or you have a site where a lot of people are visiting, you want to have that log available and kept until mandates are rescinded. Contact tracing, employee and vendor contact sheet should also be kept. Your daily COVID cleaning log, right? So in one of my projects, there's a checklist Monday through Friday, where someone has to check and say that there has been cleaning, right? We have all of them, since May, stacked, so that no one can come back and say, well, where are they? Show me that you've been doing it since May, right? Or you can scan it if you don't want to keep paper on site. daily health and temperature screening. You want to have a log of that. So maybe if you have a computer, you have that ability to do that. But I know when you have hundreds of people working on a site, like how do you keep track of people's temperature? Maybe the COVID monitor individual that you designating certify that your screener took temperature checks for everyone that came on site. And then the screening logs, COVID symptoms, you're asking if you've had any symptoms in the past 14 days, if you've had any positive diagnosis, if you've come into contact with someone that's confirmed or suspected in the past 14 days, and also if you've traveled outside of the state. And you know now that if you've traveled outside of the state, they are people that are, state troopers that are now enforcing this. So just be careful. Right? So mandatory safety plan requirements, hygiene procedures. So this is basic hand washing stations. And if it's not feasible, having hand sanitizer. So also the requirement to have signage, indicating and notifying people that, hand sanitizers are great. It's not a substitute for washing visibly soiled hands. You want to have receptacles for disposal of soiled items such as PPE, as well as maybe paper towels that you've used following washing your hands, or gloves or masks or whatever the case. That's PPE. You want to have hand washing methods and frequency, as well as the use of gloves discussed with your staff or implemented. So like I said, one of the sites that I'm at, all day long, as long as you're not eating or on a break, you're wearing a disposable gloves. You put it underneath your work gloves. That's a way of protecting that particular contractor enforced. Like I said before, you can be more strict than what the state requires. So you want to make sure you have cleaning logs, right? So, and also if you're the general contractor, you're cleaning areas such as bathrooms, porta-johns, and we'll talk a little about cleaning versus disinfecting shortly. But definitely, with regards to hygiene, making sure you have the proper supplies, you have, hand washing stations if possible, and signage reminding people about this, receptacles for disposal, and the right supplies to clean both surfaces and hands. So there are some examples of options for hand hygiene. I've never seen this many sinks in one location since COVID. They've even taken to, heating the water. There's various ways hand sanitizers are on site now being handled. You can do the pump as in the center picture, as well as spray bottles. So, and these are, kept on every floor so that there is wide access to it by workers. Are there any questions on hand hygiene or just the mandatory portion?
Not yet.
Okay. So this is poll question number 5.
We're going to give about 40 seconds. Everybody, please answer both questions. Another 10 seconds. 5, 4, 3, 2. Ending the polling. Here are the results.
Yes, so the majority got it right. So cleaning is the process of removing visible debris, dirt, as well as the pathogens that cause the disease or virus, diseases or sickness. So whether it be a virus or a bacteria, if you clean, you remove it from the surface, as opposed if you disinfect, you're basically just killing the pathogen, but it's still visible dirt there, right? And that's why they say, that's the difference between hand sanitizers and washing your hands. Hand sanitizer alcohol kills the virus, but if you wash your hands, you also remove the virus from your hands. Okay. And so, example of disinfecting is using the electrostatic sprayers or using a can of Lysol to disinfect the surface, right? Again, I want to stress that, whatever cleaning products you use, make sure they are compliant with EPA. There's a specific list that EPA says and approves that says they can actually kill the coronavirus. So if you hire an outside company to do this, making sure that whatever supplies they're using is actually meets the requirement. And that speaks to liability, which we're going to cover shortly. Okay. Cleaning, on the other hand, like I said, that is, wiping down door handles, push bar, bathroom fixtures, the porta-john handles. I've been to sites where there's a guy that walks around with a pump bottle on his back and he sprays all door handles with bleach. It's a bleach solution like throughout the day. I was just mindful to keep my distance so I don't get bleach on my clothes. But yeah, so because these are high touch areas, maybe a disinfecting walkthrough within the hoist area, because there's potentially, especially as it gets cold and they put the plastic on the side so that, in the winter you're not gonna freeze. You wanna think about the air quality inside of the hoist, right? So just understand the difference between cleaning and disinfecting and what are some of the products that you can use for both, right? So for cleaning, you can have things like a mop bucket with water. You can have a spray bottle with, a rag of microfiber cloth. You can also have, wipes, Sani wipes or whatever, and that will physically clean the surface, as opposed to disinfecting, which is like a Lysol or electrostatic sprayer. Any questions there? All right, so this is a long slide, but basically what it is a formula for, no, this is not it. All right, so the mandates from CDC of how to clean and disinfect your site if someone was found to be positive, right? So this is important, that's why it's so long. So what the CDC is, the crux of this is that if you found out like Johnny was in the shanty or he works in a shanty and he was positive, a day ago or 2 days ago, you're finding out, the next day. Close off areas used for by that person. So no one should be able to go into the shanty the next day. And then also make sure you have windows open, right? So if the area has windows, open it so that you have ventilation. You're taking out any particles from the air. And also they recommend you waiting 24 hours before cleaning and disinfecting, or as longer if you can do that, right? Because you want things to settle and so on. And just the natural course of the virus killing off due to, air and time and all those things. Clean and disinfect all areas used by the person suspected or confirmed to have COVID, such as the office, the bathroom, common area, and shared equipment, right? So this is why it's important to limit workers to specific locations so that if it comes time to, cleaning or notifying folks, exactly where they were for that day and who could potentially have been exposed or what surfaces may have been contaminated. So once the area has been appropriately disinfected, it can be reopened for use. So workers within close proximity to that person that was suspected, that were not in close proximity can return to work the next day. However, if you were in close proximity, you want to think now about getting tested to determine if you've had any exposures. And if more than 7 days have passed since the person suspected or confirmed to have COVID, visit or use the facility, additional cleaning and disinfectant is not necessary. So if you found out 7 days ago that the person was there 7 days ago and this happened, well, unfortunately, people were already exposed likely. But after 7 days, the virus is thought to be non-viable. And so the benefits of cleaning are not there, right? So that's basically it. CDC is a great source for how to clean, when to clean, what to clean with, what to use in different surfaces. You don't want to use bleach on surfaces that have like fabric. It can be discolored, carpeted. There are alternatives that you can use there. You can use steam in certain cases, high temperature steam. So there's a variety of different methods for certain types of equipment. If you're using electronics, maybe UV, the use of UV light may be best for you to clean that particular surface, because water and liquid's not going to be good for electronics, right? So, or maybe use a wipe. But CDC is a really great source for that. And before you clean, just think about that. I went to one site once where this guy gave me some cleaning products, and it was like one of those strong bleaching agents that they have at hospitals, and I should have been wearing a glove. And so my skin was like slippery and all day, and didn't know that it was that, strong. All right, so I'm gonna play the video, and then if there are any questions, we're coming towards the end.
And we're learning of a new coronavirus cluster in Brazos County, a construction site on the campus of Texas A&M. New at 6, News 3's Rusty Surratt has more on this developing story that he first reported for us on KBTX.com. Rusty?
Yeah, Kathleen, I want to point out first thing, these 55 construction workers over at the Texas A&M campus tested positive earlier this month. So they're not a part of the new batch of numbers that came out just today. But let's go ahead and get you caught up on this situation over at the A&M campus and tell you what we do know about it. Alabama-based Hoare Construction told me today that 55 of its 153 workers on site, including some subcontractors, did test positive earlier this month for the virus. Hoare Construction is the general contractor for the renovations happening over at Dunn Hall. The company temporarily suspended work and ordered all of its employees to be tested. Only 6 of the 55 confirmed patients had symptoms of the virus. Now, yesterday, I asked a representative of Texas A&M if they would share with us how many staff and how many students on campus have tested positive, and I was told that that information wouldn't be appropriate to release at this time.
We're not immune to this pandemic. We have, in fact, had folks that have had an experience with the virus, but I don't know that it's appropriate right now to really talk about numbers.
So right after saying that, Mr. Chad Wooten there with Texas A&M said that he would go back and get with A&M administration to see if there would be a formal way for them to release more information and be a little bit more transparent about exactly how many number of students and staff may have been impacted by the virus there at the
day.
Okay, so that, before I ask any questions, that speaks to, a situation where you have construction in an occupied facility, right? So we have the requirement for tenant protection plans in New York City. And so the OB is quite strict with enforcing the need for these, the safety plan, mandatory safety plans, even within renovation projects where there are occupied, right? Because there is that potential for now contractors to spread to residents, right? You're using the same elevators, you're using the same physical space. And so you still are required to keep these records and, follow these protocols because you're now involving communities, right? So are there any questions?
Yes, we have a question from Nadine Riley. She asks, will you elaborate on cleaning versus disinfecting? What products are generally common to each? Which is more thorough?
Okay, hi Nadine. So cleaning is like having a mop bucket with, maybe a regular Fabuloso as well as bleach, right? There is a 10% formula that CDC has put out that is effective for killing the virus, right? So that's a way you would clean a floor surface. Maybe you can put that into a spray bottle and clean your high touch areas such as elevator buttons, door handles, elevator buttons, things like that. So cleaning is, I would think, the more thorough, especially when you have bleach involved in there, right? Because you're physically removing pathogens, viruses, bacteria, as well as dirt and whatever else would be in dirt, right? Disinfecting is just you're using an agent that would just kill the pathogens, but you still have the physical buildup of dirt on there, grime, or whatever the case is. So I feel like cleaning is a lot more thorough because you're killing by removing from the surface, as opposed to just killing with a electrostatic cleaner or a Lysol or something like that. Or even steam, high temperature steam would be a disinfectant, because unless it's like you're coming after that and like removing with cloth or something like that to pick up the physical visible dirt. Does that answer your question? All right, so protocols and procedures for dealing with positive workers. So any individual with a temperature of 100 must not be permitted to enter the site. On no level should you allow that to happen. And that individual should then go for screening, for testing, right? So they should be sent to clinic for testing to confirm that that's actually what's going on. You may want to do two or three temperature checks to confirm that the machine is reading correctly. Test yourself, but if that number consistently comes up as 100, that person should be sent for medical evaluation, not evaluation, but testing, right? Confirmation testing. So you also want to have a person, like your person designated as the central point of contact. And that person is the person that the Department of Buildings will come to, OSHA or whatever agency, Department of Health will come to. And basically you're signing off that these questionnaires were done, and you're affirming that individuals were, temperature checked, and, all the screening protocols were put in place. Require at least one person for each customer or party. I'm sorry, that's actually wrong. But basically you wanna, for each of your contractors, you wanna ensure that each of them have their own sign-in logs, and maybe they're turning it into you on a regular basis, so that you can confirm that they're following protocols. Because, it could be that you are the GC and you're doing everything right, but then on the trade level, you're having people that are not compliant, that are not doing the logs, that are not doing the cleaning, that are not doing the postings, right? And then DOB comes to the site and, they approach them and they see a deficiency. So there isn't the checks and balances to ensure that this is being done across the board, because that one contractor can have someone that's positive that affects multiple people, and thus cause the job site to be affected from a health perspective. But then that can also lead to you getting a stop work order, right? So that individual needs to make sure that they have the proper protocols and logs, and they're doing what is supposed to be done. So I talked before about the EPA, about in the Agency and Enforcement and Liability, EPA, has designated a list of products that they have approved that will, they found to kill the COVID-19 virus. And so if you're using that as a cleaner, if you're saying that this cleaner is for, your equipment, for your tools, you want to ensure that it's on that list, okay? Or it's a bleach solution. So with regards to other agencies, OSHA, in terms of liability and enforcement, they're still a part of this game, right? So, and there's another, I'm going to point to a press release that OSHA has done. They're out there issuing signs and violations to employers when they go to job sites. And from my experience, multi-employer job sites are a means for you to have multiple contractors cited, right? And it becomes easily a significant case because of, if you have from the top, there is no enforcement, you're going to find all of this non-compliance throughout, right? So some of the things that OSHA is enforcing with regards to COVID is the record keeping requirement. So, making sure that you have the logs filled out. If someone died on your job site that's related to COVID, if they contracted it on your job site and they're sick, you want to ensure that the logs are filled out for that. So in regards to PPE, subpart I, which includes eye protection, face protection, respiratory protection, and hand protection, OSHA can enforce those standards. If you're not complying, you haven't had a written program, you don't have the adequate supply, you haven't trained your workers, you haven't fit tested them in situations where workers are wearing non-voluntary N95, like you're requiring them to wear an N95, you have to fit test them, you have to go through the full respiratory protection program requirements, right? And also hand hygiene. If you're having someone that's a laborer working, cleaning a bathroom, you're not providing them with disposable gloves, they're open to a violation there, right? Because there's a known hazard and you have to protect the workers against that. General environmental controls, sanitation is something that can be enforced. Having running water to wash your hands, having it at the right temperature, having soap, having means for you to dry your hands are things that fall within the OSHA purview. Toxic hazardous substances, making sure that medical records are kept. That speaks to the logs that the state requires, but having adequate training, hazard communication. So you're bringing new chemicals on site, right? So the individuals that are responsible for handling these chemicals, storing it, mixing them, they need to be trained. They have to be given chemical specific hazard communication training. And hazard communication, and also, you want to have the proper labeling as part of the hazard communication standard so that you don't have mixing of incompatible materials, right? Knowing how long or how effective a solution is, because there is a limit on how effective a bleach solution is. You can't, I think it's like a couple of hours or a day or whatever the case is. You can't mix it 2 days ago and still use it and think it's effective, right? There's some negligence there that would put you at liability because you didn't, follow protocol. So New York City Department of Buildings, when the inspectors come on site, the things that they are looking for is ensuring that there's 6 foot of distance between personnel, that there's a use of face masks, there's the occupancy notification on written or posted on the hoist or so on. That there's a monitor designated. So this is actually now a position that's been created for construction sites. There's a site safety monitor that's related to COVID activities that go around the site to ensure trades are complying with PPE requirement, distancing requirement, and so on. So that their Department of Buildings is looking at whether there are appropriate signage posted throughout the site, whether you have the written plan, the affirmation conspicuously posted, or even have it in general. And that you've communicated this plan to employees, to visitors, to clients. How do you do that? You have an orientation. You have trainings. You have regular toolbox talks. You keep logs. And then continuous logs of every person who may have had close contact with someone that has been exposed. Hand hygiene stations available on site, and as well a cleaning and disinfecting log for surfaces, shanties, tools, and things like that. So in terms of liability, so I can't speak to workers' compensation, but I know there are issues there. You can have OSHA as a liability because you can get, they're enforcing and giving penalties and violations. You can have Department of Health, you can have Department of Buildings, but then you can also be exposed to toxic tort claims, lawsuits, right? Brought on by individuals that work for you, that visited your site, that can say that you're negligent, based on a number of different things that you failed to do. So the precedents for this are Berner versus Caldwell, which, there is that precedence if they can prove that there's harm through the transmission of communicable diseases. Another precedence where you're liable if there's negligence exposing another to contagious or infectious disease, or if you're allowed someone to be stricken with a disease through another's negligence, and they consider that not to be no different than if you hit someone with a car, right? So there's all these precedents that are available, and I'm sure later on you'll see some commercials about, if you've been exposed to COVID at your job site, call this number, right? And some of the theories that they have is negligence in failing to prevent the spread of the virus. I mean, in the beginning, you can say you didn't know, but now there's ample information there. So as an employer, as a general contractor, you want to make sure that you follow all of these and ensure that you're complying as part of the defense. You complied with local, federal, and state guidelines. You want to be able to prove that. And how you prove that is by maintaining your logs, by maintaining all of the protocols that you're supposed to have, so that you do not become then liable to a toxic tort claim. And finally, before I go there, did you ensure exercise of reasonable care? Okay. And so just an example of some of the enforcements that's going on around OSHA. This is the latest press release from OSHA. I think this is between November 6th and November 12th. But since the start, they have now gotten up to $3 million in COVID virus related violations. So OSHA. And some of the things that they are citing employers for is violating the need to implement a written respiratory protection program, to provide medical evaluation, respirator fit test training and also training on the proper use of respirator and personal protective equipment. Like I said, if you're requiring them to use an N95, you have to, or if you're requiring them to wear a higher level of protection, like a tight fitting respirator, you have to do this, right? Reports an injury or illness or fatality. You didn't do proper record keeping, right? So if someone died, this would probably more apply to like a healthcare setting, but if you had a staff member that died and it's COVID related and it's likely to be suspected that they got it on site, then you have to report and record that, right? And then compliance with the general duty clause. So OSHA has standards that employers have to enforce, but the general duty clause is a catch-all. So if there's something that that is harmful and that measures should be taken to protect the worker and you haven't done that, they will apply the general duty clause to that, stated very simply, right? There are certain measures that have to be there. Like, this is a pandemic. There's no way you haven't known unless you're like a monk, right? And you have no access to anyone or any communication, right? But so that you have information about this. You knew people were exposed. You had the right, you had to take, you as an employee, you have to protect your workers, okay? And then just, the actual article that I found that was talking about the 88 citations, including 41 stop work orders by New York City Department of Buildings inspectors that were COVID related stop work. All right, any questions on that? And if the issues that
we do have a question. It says, what if we feel unsure that our policies and procedures are in compliance with OSHA and DOH guidelines? Can we contact you for a site visit?
Yeah, Yeah, you can contact me. And also, if you want to hear this directly from the horse's mouth, OSHA, I used to work there. They have a hotline. You can call them within the working hours if you have a question and, ask them that question. And certainly, you can contact me. With regards to Department of Buildings, I believe you can call the 311 number and speak to a member of their inspector team and ask your questions as well. And then also just referring to what's written, in terms of that's the best argument, unless they have an alternate interpretation somewhere, what's written is what you have to follow, right?
Oh, Reagan, I think that there may be, from a contractor's perspective, a hesitancy of reaching out directly to OSHA. And if they have a comfort level, provided, your company will provide site, a consultant.
Yeah.
And then you're on their side of the table, which
Yes,
I think would provide a contractor with a measure of comfort. So we're very happy at MBDA that Reagan Branch is a member of our Minority Business Development Agency Center, and we're really happy for you to contact her and ask for a consult. Absolutely.
Okay. Any other question? Thank you, Roxanne.
As of right now, no. There's no.
Okay. All right, so some strategies and solutions. We're coming to the end. So, this is an example of a company that's created a sitemap. They can use it as part of their, they distribute it to the subs, and they can use this as part of their ongoing training and orientation. It lists where you have the queue areas where you're going to line up in the mornings to get into the site. Marking of the distance requirement, where there are hand washing facilities located, right? Areas that you want to reduce high traffic, where the hoists are located, where the medical staff is located, where additional supplies are located, where the site monitor is located, right? So having these things established is important as part of your orientation process for your communication plan. All right, so listing where the access locations are, where hand sanitizer is located, and so on. This is just a closer view. Having your pre-task plan where any new task that you're taking on, having COVID be a part of that thinking of how you're going to devise being distant in doing that work, right? So pre-task plan or pre-shift, I'm sorry, this is related to pre-shift meetings, but having COVID be on top of mind for everyone when you're doing the pre-shift meeting, right? So you're going to be working in X area, you're going to be using, whatever piece of equipment, multiple people, you want to remind them, keep the doors open, keep the windows open, make sure you have a bottle of cleaner in there if you're not going to be wearing like a disposable glove. If you guys have to work in close proximity, make sure you have your mask. Maybe in addition to that, have a COVID face shield because you're going to be very close doing that particular type of work. So having that be a part of your pre-shift meeting is important because it keeps it on top of mind for the workers that, in addition to safety hazards and health hazards, you want to look out for COVID-related hazards. And that also goes for job hazard analysis, where where you have maybe certain sites require you to put together a JHA, have that COVID component be a part of that as well. All right, so we're at poll question number 6.
Again, we ask that everybody please participate. We will have the poll up for about 45 seconds. Another 10 seconds. 5, 4, 3, 2, 1. Poll is ending.
Yay, so the answers to both questions are true. So respirator, as opposed to mask, are a higher level of protection. Masks are traditionally used. I'm sorry, there's an error there. So mask is referring to like a surgical mask, not N95. So a respirator would be an N95, right? So that's an error there. I'm sorry about that. So masks are traditionally used in a hospital environment. It's a means for actually to protect the patient that are sick and maybe protect the doctor as well. But they're not as high a level of protection as a respirator, which would, in this case, the minimum N95. And just a little bit more information between the difference for a surgical mask and an N95 respirator. So surgical masks are disposable. Both are disposable, but you can wear N95 for a longer period. Usually surgical masks are changed between patients when you're thinking of a regular use pattern. So the wear, it's, the way they're physically designed are different. So the loops go around the ears on a mask. In a respirator, it's molded around the molded cup goes over your head. Both straps have to be over your head. I've seen situations where people are wearing it one strap. They're designed to provide a greater amount of seal and protection from the outside air. And so you have to wear both of the straps in order for it to work. You do not put the straps around your ear. That's not the appropriate way of wearing an N95 respirator. I've seen that as well. When you're using that, you want to make sure the metal portion is on top of your nose, the bridge of the nose. It's there so you can, mold it to form a better fit to your face. Okay. So the mask, surgical mask, is approved by the USDA. I'm sorry, the US Food and Drug Administration, as opposed to a respirator, which is as a NIOSH approval. The KN95 is similar to the N95. It's just that the KN95 is China's version of a N95, right? And some of them have met NIOSH standards, and there's a list that is available if you go to the NIOSH website, which states which KN95 are as effective as an N95. Protection, so it provides, surgical masks provide droplets, spray, splashes that contain germs, and that's why it's typically in medical industry. And those, if you think about those types of particles, they're pretty large in relation to, viruses, airborne particles such as silica or lead and things like that, right? And so the N95 is a better protection when you're dealing with those types of things. So the surgical mask, of course, is loose fitting because you have that whole gap at the side of your face, underneath your chin, that it doesn't protect, and in some cases even the upper nose area. And the N95, compared to the surgical mask, is tight fitting, right? You can mold it around your face. Some of them come in sizes. I haven't seen that in a while, but you can mold it around your face, and you can even fit test it. Filtration does not filter very small particles, a surgical mask, whereas an N95, it filters at least 95% of airborne particles, both large and small, with the smallest being I think 0.3 microns. The limitation of use, usually one time. And then in terms of N95, discard when contaminated or damaged or deformed, right? There are even some CDC guidelines on how to clean an N95, that when supplies go down. So you can take a look at that. So in terms of gloves, just bringing it home again, it's really a good form of personal protection. It's great to implement along with all of the other controls, the administrative controls, engineering controls, but you need to address who should use them, right? How to use them, how to take them off and put them on, how to prevent cross-contamination. I've seen people wearing gloves and touching their face. Makes no sense. You want to address latex allergies. There are certain people that may be allergic to latex, which is a material that can be used to make gloves. So if you know that from your staff, make sure you don't order that or keep a supply away from that person. And also have adequate supplies of gloves, right? So someone is keeping inventory of, how many you have. Think about the staff, how many times a day they're wearing it, changing it, and so on. So we covered face masks, but face shields are important as well, especially when people are, you can't get that social distance. So they are wearing a mask or they're wearing a respirator, but a face shield gives you that higher level of protection, especially if you're going to be working in a strenuous type of situation where you're breathing heavy. And so there's that chance of particles escaping through your surgical mask or through the gaps in the face shield and in the whatever protective covering you're wearing, right? So that's face shield gives you an extra level of protection. But you want to also think about how effective they are. You certainly don't want to use this alone, right? Especially if you're in close quarters with someone, because there is that chance of the wearer, if they are positive, emitting that air on surfaces and particles on surfaces or in other people's breathing spaces. So in a combination would be effective, or if someone's sitting in a booth, that would be effective. Who should use them? People that are in close quarters, like I said, or people that are not going to be exposing someone else. Making sure that they're clean, right? So at the end of the day, having a cleaning protocol in place, sharing them between people needs to be, worked out, because there are surfaces on there. There's like a spongy surface, and, how do you clean them? You need to think about that. And then make sure you have an adequate supply. Now you could possibly, so the difference between these are, this is the disposable, like flimsy glass that's used for COVID, and this is like for construction when you're doing welding and cutting and things like that. So, you don't want to interchange this one instead of this one, right? So if you're doing construction related work, you want to ensure that you have this one, the proper protection. All right. All right, sorry. Oh, so just want to bring home as well, the site safety monitor must be designated. And that person is responsible for a continuous compliance with all aspects of the site safety plan with regard to COVID, right? So making sure that it exists, it's posted, it remains posted. What's written in there is actually being complied with, because that's a huge thing for people that are in enforcement. You say on paper you're doing this, but you're not actually doing it, right? So don't have it be a dusty document that's sitting on the shelf. Have that site safety person actually make sure that it's being enforced, implemented, and so on, right? And then maintaining the records of the logs, the cleaning, the screenings, all of that, so that if any of the agencies come to the site, you can clearly say, here, we've been doing it, this is what I have. If you get a lawsuit from someone 2 months or a year from now, you can say, here, I've been doing this, whatever the case, right? OSHA comes, bam, paperwork and enforcement, because once you show them the paperwork, they're gonna walk around to make sure that that's being enforced. And that is it. If you have any questions, here's my contact information. You can certainly reach out to me here, or you can contact MBDA, Bach.
Thank you so much.